this is the proper way of administering the medication. So first is to wash our hands or disinfect by using 70% alcohol. So I already washed my hands, and but still I'm going to disinfect my hands using 70% alcohol. So next is we gather the equipments. First is the medication card. Next is the medication tray with towel, the medication dropper, and the medication glass. The pill crusher. So it is necessary if the patient cannot swallow the oral medication or the capsules. We're going to pulverize it. So drinking straw to administer because the medication can discolor the teeth and facilitate the ingestion of liquid medication. And the napkin or towel. So we are going to use this to put it under the patient's chin to avoid the spillage of the liquid medication or the water. Then the glass of water. Check the medication card first to clarify if the medication is correct. If you're not sure about the medication, we can have a look at the doctor's order so that we can again prepare the medication properly and accurately. Assemble the materials. Read first the medication several times to make sure that it is the right medication to be given. And also the expiry date. So the expiry date of this medication is on September 2021. So if the medicine or medication has already expired, then don't use it and immediately return it to the pharmacy. Before pouring the medication to the medication glass, check again the label if it matches to what is stated in the medication card. So stated in the medication card is paracetamol analgesic. So it matches the statement in the medication card. So before we pour the medication into the medication glass, shake the bottle before pouring it. Cup and place it upside down the counterpart so to prevent the microorganisms from transferring into the cover. So hold the bottle and make sure that the label fixes your palm so that if the medication spills, the label will not be erased. Medication cup, make sure that the measurements are clear so that you will not be mistaken. So stated in the medication card is 10 ml, so pour 10 ml in the medication. So don't let the beam of the bottle touch the medication glass. We can use the towel to clean the spoilage of the medication and then cover the medication in the bottle. If the patient cannot swallow the capsule, then we are going to use the pill crusher and mix it with small amount of water, especially for children. It's necessary to take the vital signs of the patient, especially if the medication is antihypertensive. It is necessary to get the blood pressure, the respiratory rate, and the pulse rate. If the blood pressure of the patient is less than 120, then we will not give the medication. Instead, refer to the patient for better instructions. Administer the medication at the correct time, 30 minutes before the correct time or 30 minutes after the time stated in the medication card that the patient should take the medication. So stated in the medication card, the patient will take the medicine at 8 o'clock. So it's already 7:45 a.m. Ways to identify the patient. First is check the room number. Next is check the identification card. So the name of the patient stated in the medication card is Vera Ashley Kate, private room number 3. Then patient for her name. Ma'am, what is your name?
Ashley.
So your last name, please?
Vera.
So it's correct. It is the correct patient for this medication. So next is verify the identification with all the staff member who knows the patient. The medication's purpose. So, ma'am, my name is Chelsea Medival. I am your nurse for 723. So your medication is dietary the patient, report if the patient refused to take the medication, document time and signature, and the patient's reason. Returning the equipment to its proper place, reassess the patient after 30 minutes to check if the patient was okay right after taking the medication. Right after taking the medication, do you feel any pain? No. Headache, chest pain, dizziness, itchiness? So, okay. Thank you.